California Practice Sales won't only put on an unsurpassed marketing campaign for you in the local Southern California market. Through our affiliation with American Dental Sales, we will also put on a national marketing campaign. So, given our affiliation with our bankers, if there's a perfect buyer out there, we'll find him or her. And if there's a way to get them financed, we can get that done for you too.
Well, I think the short answer to that is probably the internet. That's certainly the way that we do the vast majority of our business. As a matter of fact, I can't remember the last time business came to us that did not come through the websites. If you engage dental equipment people, accountants, attorneys, you certainly expose yourself to a breach of confidentiality, which we think we control much better. And kind of one of the jokes is if you tell your dental supply salesman you'd like to sell your practice, you might as well take out a billboard alongside the highway. So we think probably the internet marketing is right now the most effective.
How do I market my practice for sale is a common question. One of the things that we have done with our company, both locally and nationally, is we're on multiple websites. Website search engines have become extremely efficient. Most of the people that look for a practice to purchase are going to look on the internet. We still do print media, and we still do some local mailing postcard work for each of our doctors. But on the whole, the best marketing mix will include all of those: print media, internet, and some sort of mailing program.
ADS has a national website that our listings on, as well as our local websites. And then there are various other means that we use to market directly to students and to dentists through mailings in the area.
As a professional practice broker, we have developed reputations over the time. We speak at dental schools. We know a lot of dentists. The young dentists know us, and at all times, especially if there's an emergency, we know young dentists are looking to buy.
The key to selling a practice is not finding a buyer, but finding the right buyer. In order to do that, you really need to be anywhere and everywhere where a possible person that would be interested in your particular practice would look. That includes web presence, local journal presence in the dental schools, relationships with accountants, attorneys, consultants throughout the country to find that right buyer for your practice.
Marketing a practice for sale is tricky if you're trying to sell the practice on your own. And the reason is confidentiality is a big part of a practice transition. If your patients and your staff find out that you're marketing the practice openly, you may lose patients and staff, and so therefore you no longer have anything to sell. When an ADS broker markets a practice, they do this according to a number. Everything is confidential. Any potential buyers sign a confidentiality agreement, so therefore they will not be getting your information out to the public or causing you to lose patients and staff. And when ADS markets a practice, we use national website, local websites, national magazines and publications, state and local publications. On your own, this would be difficult because of the expenses.
Using a broker, I believe, is the best way to market your practice because we're going to find buyers that we have actually that we know that are looking for a practice in your area. We're also going to do some mailings for the different buyers that are looking in the state, and even, possibly sellers that may be looking to add to their practice.
Well, the best way to market your practice for sale is to listed with one of the larger brokerage firms in your area. I believe, especially at ADS, we are nationwide, and hopefully we have the most exposure probably of any other dental brokerage company. We're all independently owned, but we come together to market nationwide, and hopefully that generates more interested buyers, a better price, and hopefully those things more than help pay for our commissions that we charge. And one of the key components for a dental transaction is the right buyer. And if you have multiple buyers that we can provide to you, you can pick the buyer that you think is going to be the best person for your patients and take care of your patients for all those relationships that you've developed all over the years. Sometimes the best transitions after the fact, the best way to retire is to make sure you've sold the practice to a fantastic, nice person that you know is going to care for your patients and not create issues between you and him or you and your patients after they take over.
Well, there's a couple ways to market your practice, and one of them is to have a premier practice in your locale. When you do that, other dentists know, the community knows, and you've created value in your practice. Whenever someone else knows about your practice because of indications that this is a strong practice, a healthy practice, a good staff, good patient base, that carries through the industry and carries through the community. And people will always be attracted to that kind of practice. You didn't have to spend any money other than what you did to make it a strong, healthy practice. When you get ready for a transition, you want to enhance that by being able to take it to the market and allow buyers to learn about that. And they want to learn it from a professional, someone that's unbiased as to this is their profession, this is what they do. They have market comparables. They know how valuations are done. They do valuations on a regular basis of dental practices. And they can then take that to buyers. And because one of the largest components in value of a dental practice is personal goodwill, you don't get into a situation where you're having to argue the value of your goodwill with the buyer. And then if there's a negotiating going on that value, then you're not in a position where the very critical element of goodwill is compromised, because the buyer might feel that goodwill is not worth quite as much, and you're negotiating a very valuable asset of goodwill, and there could be some argument, hostility. There could be various things that could be said that could damage the goodwill. And what someone needs to understand, you don't just damage the personal goodwill of that dentist, but you damage the goodwill that's been built in that practice with staff and with patients. And so preserving goodwill and handling a transition the proper way goes a long ways in enhancing the value of that practice for a buyer. And so we don't ever want to compromise that. So there's a right time for the buyer and seller to be talking, and there are times when you make sure that the buyer is educated without him interfering with the doctor and his practice and some type of negotiations over goodwill.